Hello, I want to welcome you to today's webinar focused on integrating continuous quality improvement in both nursing and healthcare. Today, I'm honored to be joined by one of our longtime authors and nurse educators, Anita Finkelman.
Hello, everybody. I'm very excited about this second edition of my quality improvement book. It is my baby, so to speak, in that it's the book or the subject that I feel the strongest about. And so why don't we just get into that? I'm going to talk some general things about quality improvement in healthcare. We're going to examine a little bit about where the United States is today, look at some of the influences and the national quality strategy, which is very important. And some of you, this may be new for some of you, and look at the importance of protecting staff and the importance of leadership and interprofessional teamwork. Toward the end of the discussion, I'll talk a little bit more specifically about the new edition of my textbook, but let's get into the subject matter here. And look first at some of the major conclusions of the state of quality. Now, I'm not going to beat around the bush. The big elephant in the room, of course, is COVID-19. And there is no doubt, and I'm sure all of you would agree, that it is impacting the quality of care. But it obviously is not the only issue. And it just obviously came on the scene in the winter of the past winter. But status is not good with the United States. The trends indicate that the amount of money the U.S. spends on healthcare and the outcome that we get compared to similar types of countries is not as good as it could be. We have a greater number of chronic illnesses, and that impacts quality as well as obviously long-term health outcomes. We use a lot of expensive technology, we know that, and cost is a part of quality. And so that's another issue of when we're looking at the state of quality with our students. But we do prevention better, and it has made a difference. And we also have some of the highest hospitalization rates compared to similar kinds of countries. Now, the COVID has clearly impacted us from the point of view of staff issues and staff risk, which is obviously much higher now. If the students are in clinical, we've all had that concern. The issue of expensive equipment that is needed to protect anybody who's working in our hospitals today. Staffing, burnout, interprofessional issues, teamwork, all of that. We have seen with the crisis of the pandemic all over the world what it is doing to the healthcare delivery system. So if we look at quality, we kind of have to look at it, what are the quote unquote general aspects that have been going on, and then look at something like the COVID experience and what impact that has. Now, let's move along here and see what happens with our system. And we are mostly, I think, all nurse educators. Some of you may not be, and some of you may actually be in practice too. It's my personal opinion, and one of the reasons why I was motivated to write this book originally, and it took me a long time to get it published, but Jones and Bartlett has always come through for me, and they came through for me on this one. We need more content and experience on quality improvement in all our courses in nursing programs at all levels, undergraduate and graduate. And in addition, we need it in continuing education and staff education. And so our performance of our students when they graduate, long-term, short-term and long-term, is going to be very important for them to be engaged in quality improvement, as we will see in the next slide. Now, I mentioned the stress of COVID-19, but when we look at quality and we look at quality improvement, we have to work very closely with our colleagues in healthcare delivery, with the institutions we partner with, where we take our students and we have to engage our students in the quality improvement process that's going on every day with patients. And this is not just in hospitals, ambulatory care, home health care, public community health, all of the places where students might practice and where we take them for clinical. We cannot forget to include quality improvement in those experiences. And why is this important? And this is what really the content today is about. Some of the critical questions we need to ask ourselves, and we need to ask ourselves these questions over and over again. I like to use the term continuous quality improvement, or CQI, because it never ends. It just keeps going. It turns over and over and over, and we look at the quality of care. Are we doing enough to support improved healthcare? And the answer to this question is no. We have to constantly improve. How might we better prepare our nurses to engage in quality improvement and assume leadership in improving care? Nurses have a great deal to offer the quality improvement delivery process, but often we do not step up and do it, or we're not asked to do it. And this is a very important piece of understanding quality improvement. In the systems that we work in practice, the quality improvement process of monitoring care, measuring care, analysis, and actions that we need to take to improve care, these are all pieces of the puzzle that nursing students at all levels need to understand. And I'll say a little bit more about that when we talk about the textbook specifically. The next slide, we're going to talk about, I want to make a few comments because often we forget that quality care is associated with disparities in healthcare. And this has been demonstrated in the United States now, in that we have a special report that comes out annually, which is called the Quality and Disparities Report, the QDR, and the Agency for Healthcare Research and Quality puts out this report. They're mandated to report this. This gives us data, meaning faculty data, as well as clinicians' data, about what is the status of the quality of care. It is a superb source of information for us as faculty as to what we need to be emphasizing with our students, both in the classroom learning situation, whether that be in the traditional or in e-learning, and in clinical. In addition, that data now reports disparities data. In the past, there were two separate reports, a quality and a disparities report, and this has now been combined into one report. Included in here is health literacy. I think we can all say that health literacy has been a critical element when we look at COVID-19. With health literacy, it's how we get information about health and healthcare, how we understand it, how we process it. I'm talking about as consumers, okay? And then how we use it in our decision making. If we look at some of the issues surrounding the pandemic worldwide, not just in the United States, health literacy is a very important part of this. How people understand the wearing of masks or not wearing masks or distancing, and then how they then take that information and apply it to themselves in their health or to their families. So health literacy is very, very important. It's always been an important topic, and it's very integrated into issues related to quality care and to disparities. And so we want to remember that with our students. In addition, equity and our people getting the care they need regardless of culture, language, where they live, if they immigrated, if they live in the rural areas or the urban areas. All of those factors impact quality care. I don't know how many of you know about the Institute of Medicine, which is actually now called the National Academy of Medicine. In 1999, they published a highly significant report called To Err is Human. This report sort of opened Pandora's box. It made a very dismal picture of quality and safety in the healthcare system. The report data was picked up by the news, television, print news, etc., and stories were told to the consumer about safety and quality in the healthcare system. One of the aspects of that report, besides this data, which was really quite frightening when you looked at it, was that the report commented on what they called the blame game versus the culture of safety. And the blame game, we all know it. We've probably all participated in it one way or the other. And this is when an error is made, particularly they were focusing on hospitals. When an error is made in a hospital, the first step is to identify a staff person and blame the staff person, or a group of staff people, a team of staff people. And typically then there was some sort of performance requirement. An exam had to be taken, you had to learn the new administration, you had to go over the administration of medication procedure. And that was a great deal of the problems, according to this report, of the hospitals, in that staff were obviously, and accused of things that may not have been their fault. And in fact, the report said we need to look at systems issues. We're focusing too much on individuals. It's not that an individual can't make an error, but we need to look at systems. And this is one of the key things that came out of this IOM report. And they recommended that hospitals, as well as other healthcare organizations, begin to step back and take a more detailed look at errors to try to figure out what are all the possible causes. So the decision about what are we going to do to prevent it from happening again actually focuses on causes, which may or may not be an individual staff person. Now, how has this impacted nursing programs? I won't ask you to take a survey here, but we could say, what do you do if a student is involved in an error or a faculty person is involved in an error? How is this handled within the school? How do you communicate with the healthcare organization in which the error occurred? Or how does the organization communicate with you? These are all very important ways of improving care, but also teaching students about the processes of quality improvement. And so this report is a very significant report, even though it's from 1999. It is still having its impact. And the report suggests that we move to a culture of safety and not blame, and trying to look at the systems issues. In the next slide, I highlight another aspect of the IOM reports, which is looking at competencies. Now, the Institute of Medicine reports that are called the Quality Series talked a lot about quality improvement from 1999 to current day. But at some point, around 2003, they published a report which is very important, and that is, if we are going to improve the quality of care, we have to ensure we have competent staff providing the care. It's pretty simple, really, okay? And then they looked at education, and they made what I consider a highly significant decision, and I feel very strongly about this one. Instead of trying to identify what the competencies, the general competencies, core competencies should be for nurses, doctors, pharmacists, respiratory therapists, etc., they said, we want to identify the core competencies that every healthcare professional should meet. And then within those professions, such as nursing or medicine, those groups can augment those competencies. So they came up with 5 competencies, which you see on this slide. Provide patient-centered care, and today we hear more the term person-centered care, but the point is the patient is critical to what we're going to do in quality improvement, improving care. Working with interdisciplinary or interprofessional teams, employing evidence-based practice, and I would add evidence-based management to that, which is something we neglect. Apply quality improvement and utilize informatics. Now, I put QSEN up there. I'm sure many of you know about QSEN. And QSEN came after these 5 core competencies. And if you know about QSEN, you know they relate to these core competencies. The language has changed a little bit, and QSEN has 6 competencies instead of 5, but all of the areas are covered. Okay. In addition, some of you may know the AACN is putting out new essentials. Drafts are being finalized. And in those essentials, all of this is covered. Okay, I went and looked at the draft. They're all there. And in fact, in the BSN essentials from, I think, 2008, the most recent ones that are active now, these core competencies are included very early on in the document. And CCNE is now under review for a new draft of their standards also. So this is becoming very common. This language may be tweaked a little bit, but this is very important to what we're doing. If we're going to improve care, we got to have competent people, period. So what are we going to gauge in performance? And these are the key areas, as you see here. In the next slide, I want to give you some examples of quality improvement initiatives. There's a large amount of things going on in quality improvement, but up until 1999, when President Clinton formed his advisory commission to look at care, we really didn't have a very national focus in the United States on quality of care. Now, because of the initiative, and it's been going on for some time, we have many things that are going on, and I just want to cite some examples here, which obviously would be included in courses for students as well as discussions. We all know about the Joint Commission and accreditation, and that is clearly an important part. Transforming care at the bedside, magnet recognition, healthcare report cards, etc. And down at the bottom, you see Healthy People 2030 when there's a new edition out, so we have to pay attention to that, and the National Quality Strategy. Want to change, Jen, for the next? Okay. In addition, we've had some nursing reports, and you see them there on the slide. I'm not going to go over them, but these are very important because they focused on nursing and nursing care and provide us with guidance. And at the end there, the list there, you see the campaign for action, and there is a website. I'm sure most of you know that, and you can go in and see recent data to see where we're at improving the profession, which is part of quality improvement. In the next slide, you'll see legislation. Now, legislation is health policy, and it's very, very important. And as we speak now, even though it's nighttime here in Israel, in the United States, the Supreme Court is in the middle today. It began its oral presentations on the Affordable Care Act, some cases that are before the court. Highly significant for us, for consumers, and for quality improvement, because the law includes a lot of aspects, such as national strategy for quality and other aspects that are integrated into this law. It's not just about reimbursement. So it is very, very important. But you see that we have to keep students tuned in, and at the end I'll make a I'll let you share with you how we're trying to handle it with this textbook about keeping up to date. Quality improvement framework. I think most of you probably are familiar with this, but it's safety, timely, effective, efficient, equitable, and patient-centered. If you think about these, they are all parts of what we do every day and we need to do in care, and it is continuous. The three aims are quality care, good care, health for all, and costs within reason, because quality requires some money. It takes money to keep things at the performance level we want. Now, I put this up and you can look at it later if you go back to look at the slides. It really goes through the process which I mentioned earlier: monitoring, measurement, analysis, and planning for improvement. And we look at to monitor errors, to reduce errors, and identify strategies for resolving our problems. And that's the core emphasis within continuous quality improvement. I put this up here. This is old. This is Donna Bedium's model of quality, the process, structure, process, and outcomes. It is still relevant today. And when we look at care and analyze it and collect data, we're looking at the structure, the process, and the outcomes. Those are the three parts that we're interested in. And we teach our students this too. In addition, as is true for most areas, quality improvement has a great deal of terminology which students have to learn. Why do they have to learn it? Because when they go into practice, they're going to hear discussions in meetings. They're going to be asked about data collection. They're going to be asked about patient care in relationship to quality improvement terminology. So I just put a few up there. I'm not going to go over them, but it is very important that we understand the language of quality improvement. And these are some of the more common terms that come up. Okay, now the National Quality Strategy is very important, and there is a website. AHARQ maintains a website, and students need to understand what this is. There are three aims, there are 6 priorities, and they're what these called 9 levers. I'm not going to go into detail with the model. It is an excellent model. It's easy to understand. And there is a tremendous amount of information in the federal government sites about the National Quality Strategy, as well as an update on the annual reports that have to be submitted to Congress. And this was mandated through ACA, through the Affordable Care Act. And so that we know the status. This was very new for us. The country did not have anything. Starting 1999, we started to look at what kind of reports we need. And so we began to develop. In the next slide, staff safety. Well, we could write books on this now, given the last few months with the COVID, with all the problems we've had in trying to keep staff safe so that they can do the work that has to be done. And it is incredible work. But we've dealt with it with equipment, with the PPE equipment and other equipment, with staffing levels, with workloads, with stress, even the heat of wearing all this equipment is uncomfortable. And when people are uncomfortable, they make mistakes. We all do. So this is a very important concern. Obviously, I've cited some examples below, the common concerns, but we have to constantly keep this in mind, and we have to teach our students about staff safety, whether they're doing it in a simulation lab or when they're going into clinical, and keep it an open topic so they can express their concerns and their fears, particularly now. Now, leadership, of course, is a topic unto itself. And I mentioned early on when we started that we must have nursing leadership in continuous quality improvement. I don't see how you can do continuous quality improvement without nurses taking on some leadership within any of the healthcare organizations. So the skills of being a leader, the competencies of being a leader, are very important. I mentioned early on about evidence-based practice, and I said I also thought we needed to include evidence-based management, which is making management decisions based on evidence in the same way that we make clinical decisions. Very little of that is actually done. There is research, there literature that we can look at. So that's a piece of leadership that's very important. And our nursing professional organizations have been stepping up and demonstrating leadership in the area of continuous quality improvement by providing resources and guidelines. And we see, like through the AACN, the essentials, the changes. And obviously, leadership is included in those changes too. Interprofessional work and teams has also become more critical than, in the last 10 years, certainly. It's always been important, but now we're stepping up and saying it. This is very difficult for us in education, because some of you may be in situations where there are no other healthcare professional schools around you where you can have students interact more. But we must do more about helping students, when they're students, to work with interprofessional teams, so that when they graduate, this isn't a shock to them, that there is a team and they're not all nurses. And how do we work? So there's a great deal now available on this particular interprofessional education, collaborative practice, and which becomes critical. Now, what direction do we take? Okay, I know we have about 5-10 more minutes, Jen? I think so. Okay.
Yeah, we have about 10 minutes.
I'm going to do something I don't. Okay. Before we get into the textbook here, I'm going to do something I don't normally do, but I'm going to read something, okay? And it is the opening preface to the book, the textbook, Quality Improvement, A Guide for Integration in Nursing. Alice in Wonderland provides a window into a world that is confusing, often viewed as nonsensical, where language and terminology are not clear, where characters change forms and their identities are uncertain, and where time is not always based on reality. One of the main characters, the Red Queen, makes it clear that you cannot expect to improve if you allow the status quo to continue. Alice, the main character, struggles in this world to find her way, as if in a maze, not knowing where to go or what her destination may be. Alice is full of questions as she tries to make Wonderland clearer to herself and engage others. She does discover that to be shown something improves her understanding. As she says, and this is quote, "What is the use of a book," thought Alice, "without pictures and conversation?" Alice also comments on change, and this is a quote, "How puzzling all these changes are. I'm never sure where I'm going to be from one minute to another." Each section, there are 3 sections in this book, open with a perspective of Alice in Wonderland. For some reason, it clicked with me. It may be because I was an English major before I went into nursing. But I wanted something that would sort of grab the students, something different. And I picked up Alice in Wonderland while I was trying to figure out the direction to take with the first edition. And I started to read it. I hadn't read it in a long time. This works for me. I hope it works for the students. Okay, so let me just briefly go over here so you can see a summary. And if you go back and look at the slides, you can see in detail. What we have for you here in the next couple of slides is the section dividers. And as I said, each section has a page where it incorporates some aspect of Alice in Wonderland into what's coming in the chapters. I'm not going to do that for you here. So section 1 looks at healthcare quality perspectives for the students. And you can see it really is looking at, what is healthcare quality? What are the things we have to think about, ethics and standards and competencies, and change, which is an integral part of quality improvement. The second section looks at the environment in which we are trying to improve care and what is that world that we're entering. Terminology, the process, how do we engage the patient and the family in quality improvement, which is a very important aspect. In chapter 7, we look at quality and safety, the basic understanding. We get into a lot of the terminology, remember I mentioned. And then in the next chapter, we look at the stage where quality improvement takes place in the environment. What's going on in the environment? We look, which is very important. And then the last chapter in that section looks at monitoring, measuring, and analyzing quality improvement data. And then the third section, going to ensure that we're doing quality improvement. So we're going to look at sustaining the environment to do that. And last but not least is nursing leadership for quality improvement. In the next slide, you will see some of the chapter features. And I'm just going to run through these quickly. We have a number of features in this book. Stop and consider statements are a little bit different. You may not have seen those in some of the other textbooks. After certain sections, I make a statement, not a question, okay, a statement. And the student is asked to stop and think about it, okay? And each chapter has multiple statements in them. There are exemplars of quality improvement roles and responsibilities. Staff nurse, the nurse manager, and the advanced practice nurse. Those are new to this edition, the second edition. Each chapter has highlights, and there are also critical thinking and clinical reasoning and judgment, along with learning activities. And I would say probably 100% of them can be done in the e-learning environment. And I say that with some experience because long before COVID, I taught online for about 10 years. So when it certainly wasn't required. So most of this can be turned into team types of activities in your e-learning environments. And I was trying to be aware of that. In addition, there are web links to current places to get information, both for you and for the students. In the next slide, we have probably the most unique feature. It was not emphasized a great deal in the first edition. It is in the second, but it occurred during the middle of the running of the first edition. I became concerned about how to get new information, new health policy information, changes in the agencies in the government, resources that are available. So now every month, I send to Jones and Bartlett, middle of the month, a review of the literature, which is one article, and the student is directed to go there, and I have questions. I have news, blog, resources for the faculty and the students that you can go in and get updated. For example, no doubt, as soon as we hear what the results of the cases for the Affordable Care Act, the next month, I'm going to include that in my information that is posted online in the website for the textbook for both faculty and students can access. And students can access it on their own. Faculty can guide students to use it, et cetera, et cetera. But it is a fairly unique feature. And I think it's very important for this topic. There's also exemplars for evidence-based practice, evidence-based management, and quality improvement. There's an evolving case study and other case studies. There's references, appendices, etc. And as is true for all of the Jones and Bartlett books, there are resources for faculty, the PowerPoint slides, examinations. But I personally write the instructor manual. And I know hard copy wise, when I submitted the manuscript, it was over 100 pages. So it's not a small document. There are assignments, guides for what you might be both written and in class, etc. And I tie it in with the content in each chapter. as well as the features at the end of a chapter. So you will see that if you are using the book, it's available to you for faculty. Obviously, students don't see that instructor manual. Last thing here I want to comment on is the curriculum crosswalk, and you need to go back and look at this. The basic message here is ideally every program should have a course in quality improvement. That's my personal opinion. To learn the basics, to understand the process. And then this should be integrated in every course. There is no course that you can't integrate quality improvement, both clinical as well as didactic material and when you're in the simulation lab. So it is important to do that, as important as it is to integrate evidence-based practice. But I just gave you some examples here of courses where it could be integrated into. This is here for your information. As I said, there are lots and lots and lots of resources now. And this is one thing I try to look at when I do my monthly postings. What's new in the different agency, AHRQ, HHS, obviously, and you go down this list. And of course, now we have tremendous amount of resources on COVID-19, as well as safety and quality related to it. So these are all resources you need to be using, but the students need to know they're there. They need to be using them because they develop that habit, and they hopefully will continue to use when they're in practice. The last part here I'm not going to go through are some of the selected references that I used for this presentation, certainly not all of them. And I appreciate your listening to me tonight. I know we are all dealing with our changes and how we deal with them, and working with our students and faculty to continue learning so that we can have competent staff to take care of patients today, tomorrow, and in the future. And I appreciate everything. And everybody, please stay very, very safe. Okay? Thank you.
Well, thank you, Anita. That was a really in-depth look at quality improvement, why it's necessary, how you can integrate it, and a great overview of the second edition of your textbook, Quality Improvement, which is coming out. It will be available on December 3rd. And for anyone who's interested in requesting a review copy ahead of time, comes out in about 3 weeks or so, feel free to visit go.jblearning.com/QI2E. Anita has also been kind enough to give us her contact information if anything should come up. If you have any questions about quality improvement, integrating it into your course, using the textbook. Also, she highlights the Navigate Companion website that has a load of resources for you and your students as well. And I think you're right, Anita, in that we really need to capitalize more on that QI corner, which will feature monthly updates from yourself about trends that are going on and just maybe links to some different pieces of content. I know we had a couple of questions that have come in, so we'll address those. And I do want to remind you, if you have any questions, you can message me directly. I am listed as JBL Webinars. So Anita, one of our faculty asks us how you feel about the use of nursing informatics in quality improvement.
Oh, definitely. Yes, and in fact, it's included in the book, and it is one of the core competencies. If we look at data collection alone, but also in resolving issues and documentation, et cetera, et cetera. So it's very, very important. And I often include that particular topic in the monthly updates when I see things that are coming up.
Oh, that's great to know, Anita. Great to know that those two topics go hand in hand. Another question that we frequently get from faculty is figuring out maybe what courses or what degree programs to use this product in. I wonder if you could spend a little time just talking about how someone might use it in a BSN program or an MSN program.
Okay, well, ideally, if I had my way, okay, I would have a course in the BSN program and the master's course. It's on quality improvement. There's enough content there to have a whole course. but I'm not naive, and I've taught long enough and done academic administration long enough to know that may not be possible. This book can be used as a course book. I don't think in nursing we take enough advantage of using a topic like this and a textbook that would go with it across the curriculum. So in other words, students who are entering a BSN program would be requested to purchase a book like this. Okay, just it could be any quality improvement book, but obviously I prefer this one. And then faculty, and it does take time, I'm not naive about this, would discuss how they are going to integrate this content in various courses. And that can be done. And to ensure that the students get the basic information they need. In clinical, there again, every faculty who has students in clinical need to every day bring up the topic of quality care and safety. By the way, in departments in healthcare organizations, quality improvement departments include safety. Safety is rarely a separate issue. It's part of quality care. But we have to constantly bring it up with students, ask them how they plan on providing care that protects the patient, protects themselves, protects others, etc. So in the master's, the same applies, in that ideally a course, and a lot of master's programs do have courses in quality improvement. And then again, the issue of integrating it across the spectrum of courses that the graduate student might be taking. I hope I answered that enough.
Yes, that was very thorough. Thank you, Anita. A lot of times we get that because sometimes our audience tend to be mixed educators teaching in the various programs. So I always think that that's really important to cover. Another faculty member asks us, should students take a nursing research course prior to using this textbook or prior to learning about the content of quality improvement?
No. That's a short answer.
No.
And I have taught, one of the courses I regularly teach is nursing research, so I am familiar with it. And it's always a dilemma. Where do you put this course? Should it be at the beginning, at the end? I don't believe it should be at the end, just like I don't believe nursing leadership and management should be at the end of a program. This course ideally should be near the beginning of a program. It does not require that you be competent in nursing research. Nursing research is certainly discussed in this book, particularly in relationship to evidence-based practice, and enough information is given there to be able to assist the student to understand the content and apply it. Okay?
Great. That's very helpful. I think that really answers the question, Anita. It looks like we don't have many formal questions left, but I was wondering, Anita, if there are certain tips and strategies you use for teaching online, or if there's anything you'd like to share. We know that faculty have really been challenged with that, especially if we haven't.
Yeah, I can say that. I did teach for 10 years online, long before it was popular. And in fact, some people criticized me for doing it because they thought it was just awful. But anyway, I rarely lectured online. I rarely lecture in the classroom, but I certainly rarely lectured, like for a Zoom lecture. I am much more into having discussions and in teamwork. I believe the students need to work together, learn to work together and work in teams. So discussions, both written and audio, were more the things that I did. And more activities of problem solving. But rarely would I sit and lecture with PowerPoint slides. And some of the students objected to that. But I was pretty much repeating what was in textbooks when I did that, and they can read the book. So that's me, okay? And I know that a lot of students prefer to have a lecture, but I tend to be more informal in that presentation. That's one thing. In addition, allowing students to participate in making some of the decisions about the course is also very important. And when I did that, I was much more effective. Turning to the students to solve some of the problems or make some of the decisions about how the course is going to be formatted, et cetera, some of the assignments, that worked better. And it also taught them about teamwork. Anytime I could get students to learn about teamwork was much better than anything else I could do. Because you can't do anything in nursing practice or healthcare delivery without working with a team.
Thanks for sharing that, Anita. I think that that really wraps it up nicely because we've seen teamwork as, really, a theme for, enforcing and making sure that quality improvement is definitely carried out within any nurse or healthcare worker's day to day. So Anita, I want to thank you so much for joining us today. This concludes today's webinar, and I want to thank everyone for joining us today. For more information on the second edition of Anita's text, I invite you to check out the website, www.jblearning.com. Thanks again.